Healthcare innovation starts with a question and grows through collaboration. At Ghent University, we believe that the more perspectives we bring together, the higher the impact will be of real-world solutions that drive a better, healthier future. Driven by science and powered by collaboration. At Ghent University, we dare to think together.
About 2 years ago, the Special Research Funds of Ghent University awarded us a concerted research action called DediCat, Depression Digital Forecasting Tool. As you may know, depression is one of the most common but devastating mental disorders worldwide. And one of the reasons that this is such a problematic situation is that for many individuals, depression can be a recurrent disorder rather than a single episode disorder. In medical sciences, many of the very common chronic or recurrent disorders have their own detection system, like for heart failure, diabetes, or cancer. There's a large emphasis on recurrence. In depression, such a system is currently lacking. Therefore, in our multidisciplinary projects, where we combine psychological sciences, communication sciences, and engineering, together with individuals with lived experience, we try to develop such a system where we're developing a specific app where we monitor a number of important data streams related to sleep, mood, social contact, movement, and stress. For this purpose, we then apply hybrid machine learning models in order to try to get to individualized prediction of which are early warning signs for depressive episodes in individuals. How that works will be explained by Sophie later.
At the engineering faculty, we contribute to the development of the DediCat app with our expertise in machine learning and real-world behavioral monitoring. We have designed a framework that analyzes in real time the sensor data from your wearable and smartphone to automatically detect, amongst others, your activities, sleep and sleep quality, stress and stress recovery. We monitor these patterns longitudinally to identify changes over time that might be predictive of a potential depression relapse. This way, we enable a shift from subjective intermittent self-reporting to objective continuous monitoring. When designing the algorithms, we embed the domain knowledge of the mental health professionals. This interdisciplinary collaboration is crucial in shaping the DediCat solution and ensures that the app is clinically relevant, user-centered, and scientifically grounded.
As a communication scientist, healthcare apps invite me to think about how users interact with these technologies. The first question regards distress inflation. Might using the app make people more attentive to their negative feelings and thoughts? And could this exacerbate their symptoms? And what is the impact of the translation of deeply subjective mental health problems into measurable parameters? Are they communicated in a way that supports patient autonomy? And how do people think and feel about their health parameters being collected and shared with doctors, but potentially also with corporations?
The work done by our colleagues at the Faculty of Political and Social Sciences closely aligns with what we do at the Metamedica platform. Metamedica is an interfaculty initiative that adds a layer of strategic thinking. We do not focus on the medical act itself, but on governance mechanisms that surround, underpin, and fundamentally shape it. Take a solution like DediCat. It can only be accepted by patients and brought to market once it meets the relevant legal and ethical frameworks on personal data governance, for example. In Europe, we are trained to ensure compliance through by design strategies. That means we are integrating legal and ethical considerations right from the start. We, for example, identify strategies to minimize data processing, and together we explore how laws and regulations can actually enable a trustworthy ecosystem for health data sharing while protecting the rights of citizens and patients.
Enabling the use of big data in healthcare for a healthier future in a trustworthy way and with full respect for patient interests is also the goal of the Data Science Institute at Ghent University Hospital. Our mission is to provide high-quality medical data to support scientific research and improve care quality. We achieve this by combining technical innovation with medical expertise through data curation, artificial intelligence, and federated learning, but always in close collaboration with domain specialists. Because robust health data are essential building blocks for a more predictive, preventive, personalized, and participatory healthcare system. And that future can only be realized safely and effectively through collaboration at Ghent University Hospital, Ghent University, and beyond.